Digestion begins in the mouth as food is broken down by chewing into smaller pieces and by saliva releasing digestive enzymes such as alpha amylase and lingual lipase. When food is swallowed, it enters the esophagus, a muscular tube that carries food from the mouth to the stomach for further digestion. Contractions called peristalsis push the food down the esophagus. At the bottom of the esophagus, food passes through a muscular valve called the lower esophageal sphincter, or LES, and into the stomach. The digestive juices secreted by the stomach are highly acidic. When the stomach contracts to move the food into the intestine, the LES closes tightly in order to prevent these acidic juices from moving back into the esophagus, where they can cause damage. A breathing muscle called the diaphragm separates the chest from the abdomen. To reach the stomach, the esophagus passes through the diaphragm at a point called the hiatal ring. If the patient has gastroesophageal reflux disease, or Gerd, their LES does not close properly, allowing acidic stomach contents to flow backward into the esophagus. If Gerd is not treated, it can lead to a variety of esophageal problems, including ulcers, bleeding, strictures and narrowings, and Barrett's esophagus, in which the normal stratified squamous epithelium lining of the esophagus is replaced by simple columnar epithelium, which are usually found lower in the GI tract. If the patient has hiatal hernia, a portion of their stomach is protruding into their chest cavity through the opening in their diaphragm. A hiatal hernia can affect the LES and increase the risk and severity of Gerd. Some of the factors that can contribute to Gerd are hiatal hernia, as we have already mentioned, obesity, Zollinger-Ellison syndrome, which can present with increased gastric acidity due to gastrin production, hypercalcemia, which can also increase gastrin production, leading to increased acidity, scleroderma and systemic sclerosis, which can feature esophageal dysmotility. Signs and symptoms of Gerd includes epigastric burning pain traveling up into the chest, known as heartburns, which can sometimes spread to the throat along with a sour metallic taste in the mouth, difficulty swallowing, dry cough, sore throat, hoarseness, which is due to the acid damaging the larynx or the voice box, regurgitation of food or sour liquids, and the sensation of a lump in the throat. Gerd is most often diagnosed based on a patient's history and symptoms. In some patients in whom the diagnosis is not clear, 24-hour pH monitoring is done to confirm the etiology. Endoscopy is not routinely needed if the case is typical and responds to treatment. It is, however, recommended when people either do not respond well to treatment or have alarming symptoms including dysphagia, anemia, blood in the stool, wheezing, weight loss, or voice changes. Some physicians encourage either once in a lifetime or 5 to 10 yearly endoscopy for people with long-lasting Gerd to evaluate the possible presence of dysplasia or Barrett's esophagus. The treatments for Gerd include lifestyle modification, medications, and possibly surgery. All patients should lose weight if obese, avoid alcohol, nicotine, spicy food, caffeine, and peppermint. They should also avoid eating 3 to 4 hours before sleeping, and of course elevate their head off the bed while sleeping. The primary medications used for Gerd are proton pump inhibitors or PPIs such as omeprazole, which is also the first-line medication. Others include H2 receptor blockers such as cimetidine and antacids. For those patients who do not respond to medical therapies, surgery may be required. The standard surgical treatment for severe Gerd is fundoplication. In this procedure, the upper part of the stomach is wrapped around the lower esophageal sphincter to reinforce the sphincter and prevent acid reflux and to repair the hiatal hernia. Endocinch can also be done, which by using a scope, a suture is placed around the lower esophageal sphincter to make it tighter. Please support us by pressing the subscribe button and by sharing this video on your favorite social media website. If you have any questions or comments, please leave them in the comment section below. For more videos, please visit our website at www.medical-institution.com. Thank you and good luck.